Hello, my name is Zach Campbell, and I am a student at Vanderbilt University pursuing a master's degree in nursing and advanced practice. As part of my introductory curriculum, I took part in a variety of clinical settings, including a community health clinical. As students, we had our choice of several different locations and patient populations to work with. I chose to apply for a position as one of Vanderbilt's COVID-19 contact tracing participants. The student contact tracing team was a collaboration between Vanderbilt Command Center, the School of Nursing, and the Student Health Center. The purpose of contact tracing at Vanderbilt was to mitigate the risk of transmitting positive infection by requesting positive students self-isolate, as well as students found to have been in close contact with positive students. These instructions were based off of the guidelines presented by the CDC for positive cases and close contacts. While participating as a member of VUSN's COVID contact tracing team, I worked with other VUSN students in putting together a QI or quality improvement project to apply alongside the Central Command Center's established protocols. This QI project was developed after weeks of working with students in isolation or quarantine who had anecdotally reported signs and symptoms of depression. After group discussion, we as a team decided to employ methods of depression assessment and screening to the Command Center's script protocol. Along with the initial questions regarding symptoms, close contact, activity, and needs during isolation, we plan to add the PHQ-9 depression screening to the Vanderbilt Contact Tracing Program script. The screening questions we used were, have you had little interest in doing things? And have you felt down, depressed, or hopeless since starting isolation or quarantine? These screening questions were asked on the initial call and the third follow-up call. An algorithm was used to escalate any positives for further evaluation and recommendations. If the student answered yes to either screening question, the remainder of the PHQ-9 questionnaire would be asked and scored. The score of the student would then denote the level of escalation required for their immediate situation. Our team started using the QI implementation March 27th of 2021 through to May 31st of 2021. Unfortunately for our project data collection, the COVID numbers at Vanderbilt University had significantly dwindled. The team screened 42 students, with only 2 of those screened answering yes to the initial questionnaire requiring follow-up. Though our quantitative data was lacking, our team's anecdotal information voiced by a number of students during the fall semester of 2020 who were feeling symptoms of anxiety, depression, and fear while isolating as positive cases or close contact cases shows the significant effect isolation had on those students. Understanding the fact that many determinants of health pertain not only to medication access, professional provider assessment, but social support networks and psychosocial professional mental health resources. Our team of nursing students hope that the addition of the depression screening to contact tracing questionnaire script will help those students feeling vulnerable, afraid, and alone in a time of significant social development, the undergraduate experience.